Hello, I'm Fu Nguyen, and for the meningitis case study, our group was assigned patient 24. In this short PowerPoint clip, I will be going over our patient's case study and his symptoms, the staining and media procedure that we used to identify our results, and how we came up with the final diagnosis, as well as the treatment that our patient will need. Our case study patient is Nicholas, a 17-year-old male who attends an international boarding school. When he started to develop a fever, headache, stiffness in his neck, along with a possible rash, the school nurse practitioner ordered for him to go through a lumbar puncture procedure. They collected a sample of his cerebrospinal fluid, and the following table is the results of the procedure. Our patient's cerebrospinal fluid results shows that the patient leukocytes level is at 2,105, while the normal count should range from 0 to 5. An increased production of white blood cells, which are the leukocytes, indicates that the patient has an infection or inflammation in the body. We can see that there is an exponential increase there and is extremely concerning. His percentage of neutrophils is at 85%, while the normal range should be around 20 to 40%. His glucose level is at 27, which is very low comparing to normal range, which is at 50 to 80%. This explains why the patient might have symptoms of headache, lightheadedness, or dizziness. His protein level is at 120, which is exceptionally high comparing to normal range of 15 to 45. The protein levels in the blood may be elevated as the body is trying to fight an infection. First, we took our patient's cerebrospinal fluid sample and proceeded with gram staining to find the charge and the morphology. As we examine the sample and the picture of the results, we can see that it has a pink stain, which indicates that it is a gram-negative. When you look closer at the morphology, you can see many two round cells stuck together, which indicates that it is a diplococci. A particular bacteria that causes meningitis that is gram-negative diplococci that's comparable to our results is Neisseria meningitis. So as a group, how are we going to diagnose Neisseria meningitis? So first, what we did was we used a particular agar called Thayer Martin. It is a selective and enriched media that helps the isolation of pathogenic Neisseria from specimens containing the bacteria. This solid medium contains antimicrobials that inhibit the growth of any organism other than Neisseria gonorrhoeae and the Neisseria meningitis. So as we examine the results, we can identify that there is bacterial colonies that's present in the Thayer Martin agar. Bacterial growth on the Thayer Martin agar means that the sample bacteria cultured causing meningitis in our patient was Neisseria meningitis. As for the blood agar media, our results indicate that there are no hemolysis presented, which means there are no lysing of red blood cells by a toxin that is bacterial according to the lab manual. This helped us to eliminate Streptococcus pneumonia off our list and to ensure that our first diagnosis of Neisseria was correct. So through these procedures, we were able to come up with the final diagnosis for our patient. Nicholas contracted bacterial meningitis caused by Neisseria meningitis. A number of antibiotics are used as treatment for meningococcal disease. In the U.S., mortality rates are 10 to 15% for treated patients and 50% for untreated. Starting the treatment as soon as possible is crucial to reduce the risk of his death. Isolation is also recommended as it can easily spread from person to person. And that concludes our presentation. Thank you. And here is our reference page as well.